Fluorouracil cream are used to treat actinic or solar keratoses, scaly or crusted lesions, skin areas caused by years of too much exposure to sunlight. Fluorouracil cream are also used to treat a type of skin cancer called superficial basal cell carcinoma, if usual types of treatment cannot be used. Fluorouracil is in a class of medications called antimetabolites. It works by killing fast-growing cells such as abnormal cells in actinic keratosis and basal cell carcinoma. How to use. Fluorouracil comes as a solution and a cream to apply to the skin. It is usually applied to the affected areas twice a day. To help you remember to use fluorouracil, apply it around the same times every day. Follow the directions on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Use fluorouracil exactly as directed. Do not apply more or less of it, or apply it more often than prescribed by a doctor. If you are using fluorouracil to treat actinic or solar keratosis, you should continue using it until the lesions start to peel off. This usually takes about 2 to 4 weeks. However, the lesions may not be completely healed until 1 or 2 months after you stop using fluorouracil. If you are using fluorouracil to treat basal cell carcinoma, you should continue using it until the lesions are gone. This usually takes at least 3 to 6 weeks, but may take as long as 10 to 12 weeks. During the first weeks of treatment, the skin lesions and surrounding areas will feel irritated and look red, swollen, and scaly. This is a sign that fluorouracil is working. Do not stop using fluorouracil unless your doctor has told you to do so. Apply fluorouracil cream with a non-metal applicator, a glove, or your finger. If you apply fluorouracil cream with your finger, be sure to wash your hands well immediately afterwards. Do not cover the treated areas with a bandage or dressing unless your doctor tells you to. Do not apply fluorouracil cream or topical solution to the eyelids or the eyes, nose, or mouth. Contraindications. Fluorouracil cream is contraindicated in patients with known hypersensitivity to any of its components. Fluorouracil may cause fetal harm when administered to a pregnant woman. Fluorouracil is contraindicated in women who are or may become pregnant. If this drug is used during pregnancy or if the patient becomes pregnant while taking this drug, the patient should be apprised of the potential hazard to the fetus. Precautions. It is very important that a doctor check your progress at regular visits for any unwanted effects that may be caused by this medicine. This medicine may make your skin more sensitive to sunlight. Patients should discontinue therapy with fluorouracil if symptoms of DPD enzyme deficiency develop. Side effects. The most frequent adverse reactions to fluorouracil occur locally and are often related to an extension of the pharmacological activity of the drug. These include burning, crusting, allergic contact dermatitis, pruritus, scarring, rash, soreness, and ulceration. Ulcerations are the local reactions. Cases of miscarriage and above defect, ventricular septal defect, have been reported when fluorouracil was applied to mucous membrane areas. Leukocytosis is the most frequent hematological side effect. Although a causal relationship is remote, other adverse reactions which have been reported infrequently are central nervous system, emotional upset, insomnia, irritability, gastrointestinal, medicinal taste, stomatitis, hematological, eosinophilia, thrombocytopenia, toxic granulation, integumentary, alopecia, blistering, bullous pemphigoid, discomfort, ichthyosis, scaling, separation, swelling, telangiectasia, tiredness, urticaria, skin rash. Special senses, conjunctival reaction, corneal reaction, lacrimation, nasal irritation, miscellaneous, herpes simplex.